So can you see my presentation slides and listen me well?
Yes, that's good. Yeah, okay.
Great.
Everything's fine. Yeah.
Thank you. Okay, good evening from South Korea. Thank you for organizing this wonderful conference. I'm really thrilled to contribute by sharing my research. I am Young Kim at Gyeonggi Research Institute. If I give you a very short geographical background, the city of Seoul here is surrounded by Gyeonggi province, and the two regions make the Seoul Metropolitan area, or the greater Seoul area, together with more than 25 million population. So in this presentation, I'd like to show you how COVID-19 changed human mobility in the Seoul metropolitan area, in particular from the perspective of the urban network. Okay, since the pandemic hit the cities around the world, one of the key questions for researchers in cities and regions was this: is the urban density an enemy in the fight against the pandemic? The logic was simple: more people, more contagion, and more infection. Unfortunately, New York City and large metropolitan areas showed more confirmed cases and higher death rates in the first wave of the pandemic than rural areas. I think Seoul and its metropolitan area was not an exception. The greater Seoul area accounts the half of population in South Korea, but more than 3/4 of the confirmed cases have come out from the region. Let me see. I'm sorry. Yeah, this figure is not shown. But anyway, yeah. On the other hand, there was an empirical evidence that urban density was not correlated to the number of confirmed cases in Chinese cities. Another notable approach is on the connectivity between cities. In other words, intercity network. I think high urban density doesn't really literally mean that everyone is bunched together shoulder to shoulder in everyday life. It rather means that high population density increases the possibility and frequency of contacts and interactions in cities. So building on the point, Jia and his colleagues investigated the population outflow from Wuhan as the main factor of the distribution of COVID-19. And The Economist magazine showed that interconnectedness of cities is positively correlated to the number of cases. So in this presentation, I'd like to show how I apply this network approach to the Seoul metropolitan area and investigate the change in the population flow. So how can we empirically investigate the population flow, intercity connectivity, and coronavirus? I used living population big data collected based on the real-time location of cell phone activities. This data can be also transformed into network data, as subscribers' billing address and real-time location are understood as their origin and destination. To begin with the overview of the living population in Seoul, this calendar shows a sharp decrease in living population after the first wave in late February and early March 2020. The ratio of population inflow from other regions to Seoul dropped from 14% to about 11%. It recovered over the several months, but the second wave brought a similar sharp decrease in August. On the other hand, Gyeonggi province, which is the outskirts of Seoul, showed the population increase. If we compare the daily living population of Gyeonggi and Seoul in blue and red respectively, they are basically symmetrical, mainly because hundreds of thousands of people commute from Gyeonggi to Seoul. Before the pandemic, the gap between Gyeonggi and Seoul was very narrow on weekdays. However, the gap widened after the first wave and the trend kept going. The second wave further broadened the gap. I think the new normal trend implies that people in Gyeonggi go into Seoul not as much as before the pandemic. Then I applied a network approach to population flow. In other words, the origin and destination information of cell phone subscribers were transformed into network data and aggregated at the level of neighborhoods. If the overall patterns before and after the first wave are compared, the dense network within the city of Seoul has been loosened due to the pandemic. If I look into the three city centers of Seoul, Gangnam, Jongno, and Yeouido, population inflow from not only are the neighborhoods of Seoul, but also from Gyeonggi area significantly decreased after the pandemic. So based on the exploratory analysis shown so far, I went back to one of the main debates we face. Is urban density an enemy in fight against the pandemic? Rather than blaming urban density, I suggest thinking this way. The pandemic is a catalyst that accelerates the slow change we already had in the 21st century. As Barr stated, there is a balance between two opposing forces, centripetal and centrifugal forces in cities. Those two forces can be also translated to the traditional debate between centralization versus decentralization and concentration versus dispersion. Urban scholars have shown that job opportunity, innovation, urban amenity, and urban vitality attract people to live in cities. On the other hand, pollution, traffic, crime, and high rent make people move out of cities. In addition to that, information and communication technology allowed remote working since the late 20th century, but the transition has been very slow. Then, boom, COVID-19. The pandemic suddenly put us in a great social experiment of flexible working in terms of space and time. So this online conference is also a good example of the social experiment we are forced to conduct. If so, an important question would be, what kind of new factors in terms of centripetal and centrifugal forces are significant in the post-COVID city? In my empirical research, economic complexity and flexible working were tested as new factors of centripetal and centrifugal forces, respectively. On the one hand, building on Hidalgo's idea of economic complexity, I calculated a complexity index for every neighborhood in my study area using the number of firms by industrial sectors. On the other hand, the flexible working adoption rates was transformed to the flexibility index to represent a new factor of the centrifugal force in the post-COVID city. Then here's a quick summary of the rigorous analysis, including complexity index, flexibility index, and other relevant variables. The dependent variable is post-COVID population flow minus pre-COVID population flow. In other words, a positive value means an increase in population inflow after the first wave of COVID-19. A basic assumption underlying the fixed effect model is that population flow follows the gravity model, which includes the residential population of origin and destination and the geographical distance between them. Okay, my first finding is that the complexity index was shown positively significant. This means that the variety and complexity of economic activities contributed to an increase in population flow over the pandemic. Second, the flexibility index was found negatively significant. This finding implies that the possibility of flexible working can work as a centrifugal force that suppressed population inflow to regions. Third, a dummy variable on the same reason shows that population flow over short distance within the same city increased. Okay, let me conclude. The main contribution of my research is that the new factors of the centripetal and centrifugal forces are suggested, and the change in the balance between them was investigated by population flow big data. But I'd like to also note that living population big data can be problematic for investigating long-term change because there are so many factors that bring population in flow. For example, urban redevelopment, renewal, and regeneration projects can bring thousands of people in a month or two. Lastly, I hope this type of research can support an evidence-based policymaking process to avoid dilemma among public health, economy, and liberty. Micro-scale social distancing measures should be designed based on the deeper investigation of population flow. Okay, thank you for your attention.